And I don't want to give you medicine if you don't need it. They get all their immunizations. I haven't given needles to babies in 35 years. And it's all done at the health clinic by the nurses, so they dislike them, not me, for sticking the needles in. Okay, bye, Emma.
And this, says Dr. Mario Tedeschini, one of Edmonton's best-loved pediatricians, does translate into healthier Canadian children. One of Dr. Tedeschini's patients, 12-year-old Monica Hennon, tested the system. She developed severe liver disease even before she was born.
She actually had her first surgery when she was 6 weeks old, and then did okay for a while, but then had to go on a list for a liver transplant. Had her first transplant when she was 3, and her second when she was 4. So
I went through my chart, and I've seen her around 85. That's not counting visits in the hospital. That's just in my office, because she had a lot of trouble with recurrent infections when she was on the immunosuppressive drugs.
Today,
is there anything you can't do because of your medical condition?
Not that I know of. No.
You can't play football.
I like to play football. I played in gym.
No contact sports.
Yeah.
And how much has all of this medical coverage, literally years of it, cost you?
Well, nothing really. Parking at the university hospital is what I've had to pay for. That's just about it.
if you want to see the Canadian healthcare system at its best, you need to use a wide-angle lens, because here the focus is not on individual medical miracles, it's on comprehensive medical coverage. Everyone here at the West Edmonton Mall, everyone in Canada, is guaranteed free medical care from cradle to grave.
Well, I had a little accident on July the 23rd, and I sort of passed out and I hit the ditch.
Marv Stefanishin almost died two ways. A heart condition caused him to crash his car. Now, like most Canadians whose ailments are not life-threatening, he is waiting, in his case 3 months, for surgery.
Has it been hard on you at all, waiting?
No, time has gone by fast, and the 3 months you sort of get used to it, and you prepare yourself. So, no, it hasn't been a problem for me.
Maybe Marv doesn't mind, but a still unpublished study says the Canadian system has been waiting too long, too often to do heart surgery, sometimes costing patients their lives.
Well, I think the new information is accepted, and it's never hard to convince cardiologists they need to do more.
Cardiologist Dr. Stephen Archer says Canadian healthcare is responding, changing its practices, and adding new facilities to cut down on the waiting times for heart surgery.
We're building a $125 million heart institute here, and we're adding an additional cath lab and an additional electrophysiology lab.
A year and a half ago, there were 400 patients who were waiting for open heart surgery in Edmonton. We've got that down to 177 right now here.
Still, no one denies a heart patient in America is likely to get faster, more state-of-the-art treatment than in Canada, if he can pay for it.
Let me know when your ACT is okay.
The less responsive Canadian system takes care of everybody, whether they can pay or not, and does so for about half what America spends to leave 40+ million people uncovered. How do the Canadians do it? They pay their doctors less, about a third less than American doctors make. They pay less for drugs because Canada's provinces, as big bulk buyers, bargain hard to drive down prices for their patients. And Canadians avoid hundreds of billions of dollars that Americans pay for non-medical services like high salaries for the CEOs of insurance companies and HMOs.
Well, if we could run our system as efficiently as Canada, we could save over $200 billion a year on administrative costs. That's enough money to cover all 44 million uninsured Americans, to improve coverage for people who now have only partial coverage, with no waits, no shortages whatsoever.
Part of what Dr. Woolhandler objects to are the costs of competition, which also has its benefits. Free market competition drives technological development and keeps doctors and hospitals improving to attract paying customers. Competition is one of the reasons the best American medical care is the best in the world, too.